Welcome, ladies and gentlemen, back to the House of Common show here with the boys, hanging out in our season finale taping. If you are watching this on YouTube, do us a favor. Don't just watch this video, but subscribe to the channel. Make sure to like every single video that we have, and then leave comments on the videos as well, because we love to be able to interact with you, whether you agree with us, whether you don't agree with us. Letting us know how you feel about the video lets us at least know that you care about what we are producing. Are you somebody who loves podcasts? Well, you can find us on Apple Podcasts or on Spotify. Make sure to subscribe to those channels and then leave a 5-star review so we can move up in them rankings. Gentlemen, the world is on fire right now because of the issue of masks. Where we live in the province of Ontario in the country of Canada, today we normally record on Thursdays. Tomorrow, officially across our province, it is mandatory that if you go inside any store or anywhere of where there are people, that you have to wear a mask. And there have been arguments for, and there have been a lot of arguments against the idea of masks. And so we want to, as the House of Common, have our own discussion about masks and whether we see the value, whether we see there's no value, whether we think this is something that is brought to us by the deep state and 5G networks, or whether this is something that is just simply just overblown way out of proportion. So, gentlemen, I'm going to pose the question first to you in the house. If you are pro-mask on, please raise your hand. Okay, and judging by that, if you are anti-mask and you are pro the anti-deep state, 5G networking, all that stuff, all those things.
Whoa! No!
I'm not going to say that yes to that.
I'm kidding. Relax. If you are non-mask, if you are mask off, put your hand up.
Oh, the people that work together.
Herd immunity.
So let me ask this question then. I'll start with you, Jonesy, because you and I, we've talked about this a little bit.
Sure.
You put your hand up saying mask off, mask on, mask off. You said mask off. Why are you mask off? Why are you anti-mask?
Sure. Now, to begin with, I'm still going to obey the laws of the land, so I'm still going to wear a mask inside the store.
Christian boy.
Don't worry, I'm not going to disobey. But at the beginning,
Andrew, none of us are worried about that when it comes to you.
Like you said,
none of us are. None of us. Like, can you imagine? Guys, wait, stop. Could you guys imagine, like, Andrew, like, I'm not wearing this mask, and then, like, people are videotaping Andrew as he's going absolutely crazy? Could you imagine what that would do to us?
losing my mind.
That being said, Adam Hoskins would love that because it would mean more publicity for the show. So.
Listen,
All right, Jonesy.
at the beginning of this whole COVID thing, they warned us. They actually said, don't wear masks. That masks are not safe, that they're not good. And now they've changed their tune. You're telling me all of a sudden they've become safer in the last 3 or 4 months, that now we can wear masks?
Data, information.
No.
Let him finish, Bart. Let him finish, Bart.
Because here's the thing. We talk about data. Let me give you some data right now.
Okay.
Is it, wait, guys. Wait. Is it data or data?
Data.
Whatever.
It's an
Let
A.
me give you some data right now, okay?
It's zebra.
In the world,
Canadians.
hold on, everyone stop. So in the world,
You're done.
we have less than 1% of the population sick with COVID, okay? In Canada,
It's not even close to 1%. It's a quarter of 1%. Less than quarter of 1%.
Hold on. Let me continue. So in Canada, we have 37 million people. We have 107,000 people that have COVID. That is way less than 1%, okay? So, and we're on total lockdown, having to wear masks and everything. Now, let's go to countries that do not have any lockdown, have no mask requirements, whatever the case. Sweden has 10 million and 300,000 people. How many COVID cases do they have? To date, they have 74,000 COVID cases. That is way less than 1%. You have to get to 100,000 to get to 1%. South Korea. Now that's a population lower than us. A population higher than us. South Korea has 57 million people. No lockdown, no restrictions. They have 13,000, that's it, of COVID cases. Okay? And then we've got another country, Tajikistan. I don't know what Tajikistan is. I don't even know where they are. But they're another.
But if you're a viewer, we welcome you to the House of Common show.
We welcome you to the House of Common show.
Congratulations.
Come on, Andrew. The one guy from there gets a shout out.
And let us know where it is.
Listen, they have 9
Central
million
Asia.
people. They have 9 million people. 6,300 344 COVID cases. I'm not saying that COVID is not dangerous. It is dangerous. I'm not saying that we need to not be careful, because we do need to be careful. However, how come all these places we have a total shutdown and we have the same amount, if not more cases than places that don't have these restrictions? Now, yes, there's certain populations of our certain demographics of our population that can get sick more than others. But I think if people can be careful, and if people are being careful, because we only have less than 1% of the population sick in Canada, so we are being careful, that we can do this without masks, because other countries have shown that they can do it without masks and have less numbers than we do, who are being so constricted during this time.
Can I jump in?
Sure.
Yeah, I'm ready, yo.
So I mean, you're absolutely right. We can do it without masks, but why? What? How does that help? It's like, and full disclosure, Bart, you might have to put like an explicit thing. I can have sex with my wife, and I can pull out, and there's a chance where she's not gonna be.
He's married, y'all. He's married, y'all. I guess he can say that.
You can't do it. Please.
But
He's married.
Understand the context.
It's
I can pull out,
Keep it
and
in.
there's a chance that she won't get pregnant.
Keep
Or-
it in.
Guys, let him finish.
Let's
You're
not
done.
be.
You're done.
Let him
All of you are
finish.
done. Continue.
Yeah.
Continue, O'Shea.
Like, the reality is, I can pull out, and there's a chance that she might be pregnant, and there's a chance that she won't. I can also strap it up,
9 months.
and there's a higher chance that she won't get pregnant. So yes, there is that option, Andrew, of saying, yes, we are doing fine without a mask, but why not take that extra precaution?
Because there are people that still get sick through the mask. There are people that with respiratory issues that can still have problems with the mask on.
But there's
a
more
minority
people that
compared
get
to
sick
everybody
without
else.
the mask.
Yeah.
Okay, so
how do we-
let's
guys,
no.
we know
Let's go to Bart. Let's go to Bart. Bart.
Because-
Andrew,
Okay,
you had your time.
I'll
Bart,
rebut after. Okay.
you had your time.
So
Bart, your turn.
Here is the big.
I'm ready.
No.
frustration.
Andrew, you had your time. Bart, continue.
I don't know.
This is the front. You can't let the man have the last word, Andrew. You're the worst, bro.
You can't. No.
boy.
No. He just did. He just had the last word. He's done. Bart, continue.
Okay. So here's the fact of the matter. The responsibility lies within the local and provincial, federal government to protect us. So my question, if Andrew, I'll ask you to respond. What measures can that can be quantified would you put in place if you can't put masks? You're saying that let people just go back. You're saying let there be restrictions on how many people go into a store, how many people can go into a mall. Which is easier to enforce, which is easier to maintain? Because you have to understand, from a management perspective, politicians are trying to manage people. They're trying to protect people. And you cannot leave it be, well, the masks are ineffective to a certain extent, or the masks only protect certain types of people, and then say, so we don't want to do that. So it kind of goes with the analogy that O'Shea is saying. You have to be able to quantify measures that you are taking towards protecting people, even if they seem minuscule, even if they are temporarily inconvenient. Now, everybody here has worked or works inside of a church, and you guys all take preemptive measures to protect yourselves from liabilities and to minimize risk. So what risks would you want to exploit to have yourself live the life that you want to live, Andrew? Please, I release my time to you.
Because you even said it. You said that, there's numbers and how many people are allowed in the store. That's not going to change. You do know that, right? That even with the masks on, they're not going to let everybody in. They're going to keep the numbers the same. Where they're going to let in. So if we're already taking these precautions, all I'm saying is all these restrictions, I don't think are helping us. Because what they're doing is, and I know that once everybody's back in phase 3, the spike is going to go higher. And the reason why the spike is going to go higher is because we have not built an immunity. Our systems have not been built because we've been cleaning our hands like crazy. We haven't been around each other like crazy. And so now when you put people back into normal society, they are going to get sick. and people are going, the level's going to raise that we're going to be shut down right again.
So
That's why
your solution is let people get the virus now so we can get over it faster.
No, what I'm saying is allow people to be around each other, allow immunities to be built up. You know, in this whole thing,
we don't have the information to know how people are going to respond to having the coronavirus.
So we have no idea. You just said it right there. We have no idea. Cool. So we have no idea for or against it. What is going on with you?
The fawn's having a night, man.
My wife just walked in.
What is
guppy thing?
What? You're ridiculous.
All right, so let me.
Here's a question.
Yeah.
In this whole thing, have you guys heard anything about taking vitamins or anything? I'm not saying vitamins are the cure, but vitamins build up our immune system.
Hydroxychloroquine?
No.
Bleach.
You watching some Alex Jones, bro? Is that family?
I'm just talking basic vitamin D and C just to build up our immunity.
I think. Well, I mean,
we haven't heard anything about that.
But this is a
I have
flu.
one last thing I want to say. I'm not going to say anything else. I have one last thing I want to say. There is two approaches to this. Either you trust the government to try to do the best thing, or it is a wild, wild west. Seems to be no in between. Because what you're saying, Andrew, is negating the fact that there is a health organization that is testing people for antibodies after they've had it, and they are testing people proactively that do not have it to see what is the chance of them catching it within their own community. This is happening right now. So it's a matter of, do you want the people that are in charge to do the job that they have been assigned to do, or would you rather just be like, yo, whatever, this is not helping anyway, so we might as well just do it? But there is a system in place.
So Bart brings up a really, really, really good point, and I'm going to bring this to the house now. You've just watched a beautiful tennis match between Bart and Andrew. There was drama, there was action.
There was fear. Fawn got scared.
O'Shea jumped in there as well, talking about.
And there was sex.
Oh my goodness!
And he jumped back out.
Oh my goodness!
So the question
the season finale.
And so the question
Hopefully we
then
can
is
have
this,
a season 2.
and then the question is this. Obviously, this idea of not necessarily COVID, but the masks in particular have been a measure of contention with a lot of people. You cannot get through moments on Facebook is the worst place in the world right now because of the amount of posts for or against or in between, all this sort of stuff. So I bring it up to the house. I'm going to start with I'm going to start specifically with Calvin, because Andrew, I recognize and I love you, Papa Jones, but you've had a lot of time for you to have a little bit of a little respite a little bit. So we're going to start with Calvin. Calvin, why is this issue in particular, do you see as an issue of contention with so many people?
I think people feel like they're being controlled, and that there isn't enough data to really explain why. And I mean, I've talked to so many people, and I asked them, how many people do you know that have got COVID? And all of them say none, right? So I think there's just this element of I don't trust that it's actually as important as people are saying that it's important. And then there's all kinds of like internet science, Facebook science that says, well, it will do this to you or it will do that to you. And I think most of it is like, I think most masks are ugly. You know, I ain't got that. I doubled up on a couple dope looking ones, but I think it's just like there's this sense of don't tell me what to do if you can't prove it, and you're messing up my normal.
O'Shea.
Yeah, I think it's a problem because you're taking people's control, you're taking people's freedom of choice, and it sucks. I'll be the first one to say, like, I hate the fact that I have to wear a mask. I hate the fact that there's all these precautions, but the reality is, if me sacrificing 3, 6, 8 months of my life to keep someone or the people that I love safe, the people that are close to me safe, why not? Why not sacrifice on my part? Isn't that, and dare I say, isn't that the Christian approach? Isn't that the Jesus approach?
This guy
Look at the
had
amount
to
of
do
times
that.
that
WWJD.
like he sacrificed the ultimate sacrifice for us. So how much is it to put on a mask and suck it up?
All right, so I've heard a lot of, in terms. I hear what a lot is saying in terms of why you're for it, and I do believe that a lot.
We're not talking about.
I know, and I'm going to bring it to the contention. Why it's contentious? Okay. The reason why it's contentious is because, and what people that are for it don't realize is that it is a lot of what Calvin is saying. It plays into it, that they are trying to control. And the thing is, if we were to step back and just look at just the data of what's being presented to us, and Andrew kind of alluded to it, and yes, me and Andrew work together, and so we've had these discussions. But when we look at the data itself, I don't know if what is being communicated in the media is the full truth. Like we're being presented with something that's to tell us that this thing is, the most deadly thing that we've ever faced in the history of humankind. But is it really? I feel like if we look at other data and we look at other diseases that have been out there, they've actually been worse than COVID. And yet for those diseases, we never shut down the entire world for this. So when I look at it and comparing that and saying that there's other diseases that have been, yes, they were, like, in terms of the population of where those diseases were, they were more deadly in terms of the percentage of the populations of the people that contracted it versus the ones that didn't. It was more deadly, that there was higher population of the individuals within those spaces that got it. The reason why this thing's traveled is because the people who had it came and brought it over here. But in the situations where those were the other diseases that we could bring up, those people remained where they were, and it didn't follow into the rest of the world. And so because of that, I'm looking at it and saying it's contentious, because what you're telling me now is based on these numbers that are not even more deadlier than other diseases. I have to now change my whole lifestyle because of it. And I also want to speak to just even little things. The main body that's really directing and giving us information is the CDC. That's where everybody seems to be getting their information from. And what people don't understand is CDC is not a law-making body. It's not even a branch of the government. It's a for-profit private corporation.
Not
people
in
have
Canada,
to.
That's in America.
It's an American, but in Canada, that's where they're getting a lot of their information from. The CDC.
That's also incorrect. It's more from the WHO.
Is it from the WHO? Yeah.
And from our
Okay,
own,
so if we're going to go to the WHO, the WHO actually put out things in regards to masks that say the wide use of masks by healthy people is not supported by current evidence that would say that this actually helps to prevent the disease. This is something from a publication from.
Yes, they did say that early on.
For the
new information from that.
And there is currently no evidence that wearing a mask by healthy can prevent infectious diseases. This was from the WHO. I don't know what new things will be put on, but how much more, like what now would change that perspective of that, other than maybe something that's driving this to say that we need more people to actually breathe this type of fear for whatever reason, why we're now having to shut down this entire world for this disease that is not even more deadlier than previous diseases that have been put out. The British Medical Journal as well has said, Journal has said that face masks make breathing more difficult for people, and that it's actually worsens their breathlessness. And so now we're talking about making people even more able to be able to breathe from the mask from their mask over long term. And then what are the future ramifications if we were to do that? They say that this again, the British Medical Journal, that mask fabric can determine an increase in viral load, and therefore they can defeat innate immunity and increase. They say that it can increase infections. This is what the British Medical Journal said on April 9th.
Reem.
Yes.
Say this like. Did y'all just catch Pastor Reem there? Increase. I said increase.
Stop this right now.
Ha!
Okay, so but I'm confused.
Things wrong with what you said.
I'm next, Calvin.
There's a lot of things wrong with what you just
Actually,
said.
I'm so confused.
So no, okay. So actually, right now on the list we have is it it's Stefan and then it's Adam.
So I think I'm with Cal. The point of contention is people just don't want to be controlled. People just have this thing where, listen, don't tell me what to do, and that I think is at the heart of it. I don't I'm not a fan of wearing a mask because of my job. Sometimes I have to wear a mask, really just to keep up public appearances. I'm not going to lie. But other than that, I'm not wearing. I really don't like. I don't wear masks 95 most of the time. A nurse actually told me this recently, about a month ago, is that when people are wearing masks, they actually aren't helping themselves because
100%. I've heard multiple nurses tell me the same thing.
When you're wearing the mask, guess what happens? You get stuff on your hands, but your mask it feels uncomfortable. So what do? You adjust it, and the same germs that you're trying to stop from getting in through them with your mask on, you're just putting them on your nose or you're putting them around your eyes. So it causes you to touch your face more often because you're adjusting it on the constant, and so you're getting germs, or the droplets are landing in your hand. If you're on the subway, who knows what might happen, what you're touching, what someone else has touched, and so now you're touching your face, adjusting the mask. So, I think what this is really a placebo. People wear the masks to feel better, and if it makes you feel better, then by all means wear the mask. If you we don't have the information, we don't have the data. The data continuously changes, right? The information continuously changes, and so nobody really knows. Unless someone has faced COVID-19 before and is just hiding in the corner of the earth, not telling us because they're still covering up their DeLorean, we don't know, and so we're learning every day as we go along.
He said the DeLorean. I like that.
Hosky.
Oh, I don't want to swear.
Then don't, brother.
Please don't. We don't have an explicit rating.
But we do want, so if you got to, do it.
But this episode already has sexual content, so go for it.
I just feel like this is the most North American conversation I've had all week. In terms of, point of contention really is free will. And yeah, you guys have outlined that, but I'm like, man. Okay, all the information that you guys are reading, the British Medical Journal that you're reading, Kareem, and whatever you're reading, Andrew, whatever we're reading, Bart, as well, information right now is so skewed in terms of you get the facts that you want to hear. It's all echo chambered. A lot of it is just you're just hearing people and you're getting fed things that are just confirming your bias. And so it's very difficult to trust the information that is coming out. Here are some things that we do know just from life experience. Medical professionals wear masks for upwards of 8 hours a day consistently and have been for years, with little to no repercussions of what's happening, in terms of their respiratory diseases and whatnot. It's only now that we're seeing things. The other thing is, if you guys actually look at the mandates of what's happening, is you can actually get a medical exemption. So if you're having trouble breathing, just go to your doctor or call or FaceTime your doctor. It is so easy to get a medical exemption.
That's too easy of a solution.
You don't even have to do that. Just tell people you have a medical issue.
Sure, whatever.
And then also make sure that people aren't recording you while you're saying that.
Sure,
right.
But just, you know what I mean? There's ways around it. But the reality is I think this is in some ways, this reveals our entitlement and our privilege in big ways. This exposes us really big in terms of you have opportunity to actually help people around you. And I think that it's that there aren't a lot of us that are maybe exposed to a significant populace of COVID. But the reality is that there's COVID cases all around us. If you live in Pickering, there's a nursing home that is absolutely overrun with COVID cases. There's actually 4 or 5 of them in the GTA right now that have COVID serious outbreaks, in terms of there are people that are dying and they haven't even been able to tell their families. If you look at the states in terms of the number of COVID cases, New York is a complete hotbed. A couple weeks ago, they were loading bodies out into freezer trucks with the amount of people who had died because the medical system had been overloaded and people were not able to get help. So all I'm saying is this, is that we don't know the information, right? We're all listening to our own echo chambers and stuff. The people that have been placed in authority over us they're not telling us to go, take a bath in hot frying oil every night and scald your skin and stuff. Just wear the damn mask. That's all you got to do. Like, just put on the mask, go into the store. If you can't wear a mask because of a medical exemption, call your doctor, get a doctor's note. It's simple. That's all it is. And it's like, this is going to be over in 6 months, a year's time. We see this in terms of Italy. We see this in terms of Sweden. We see this in terms of, like, there's so much data out there in terms of this is actually going to pass us. Who cares? Wear the damn mask. That's all I got to say.
Timothy.
But so before you say that,
Timothy.
both
No,
me
no,
and
no,
Andrew
no.
said we're
No.
gonna wear the mask. We just don't think that the whole thing that what they're pushing is all what it is. That's all.
Thank you, Kareem, for that indication that you're going to follow the law. Timothy.
I find myself working in an environment that is frequented by the public on a regular basis. To be able to interact with myself and coworkers, you're required to have a mask to be able to step foot into the facility. It's something that if you don't want to do that, there are things for you to be able to do what you want to do and what we can do for you in store on your own. I know it's also when Reem went off on his list of stuff with the WHO and what they had said and everything else. It's like they updated on June 7th. I'm on their website right now, and I won't bother reading it all off, but you can go and check it out. They have a great Q&A that is basically what is the WHO's view on masks. Do they advise the use of non-medical fabric masks in the general public? And they go on and on and on and on. And that is one of the things that you yourself can actually go there to educate. Because I know it's something that going through all of this, it's like people will always hear what they want to believe. And it's one of those things that also... it's like, yes, there are countries that don't necessarily have the same measures as we have, but it's like we are where we are. And so it's one of those things that they say wear a mask, and it's like I wear it. It's like I wore one for 4 hours today. I wore it for 8 hours yesterday. Was it uncomfortable? Yes, but it was also doing my part to be able to keep the people that I interact with and call friends safe, and also to be able to interact with the stranger that I haven't met until that moment and probably won't see again, to keep them safe as well. And so I wear a mask not because I enjoy the challenge of having to breathe through layers of fabric, but it's to be able to do my small part to keep others safe, even if it's at my own expense.
Oh man, yeah. I agree with Tim. I'm with Tim on that. Just again, we also I think common sense just needs to prevail. People get heated over this. I've seen crazy Facebook posts, but if you go out in public, wear the mask. If you don't want to wear the mask, just stay home and have food delivered to you, have your groceries delivered to you. You know, if you feel like, it's going to restrict your way of life, then, stay home. But at the same time, who am I to tell anybody what to do? I'm just a humble person. Whoa, easy.
Hey, don't put it.
easy.
Can't put that on the streets.
You can't
we got-
put
we got-
a
we
mask
put-
like that.
Can't be putting
Can't
him on
do
the streets
that.
like that. Can't be doing that.
Can't
Can't be doing that.
mess up my money like that, fam.
No. Jason, fun guy.
Yeah, I mean, the mask thing, just in my opinion, when we look at COVID-19 and you look at what's going on, this thing's been around. This thing got around the world in a couple months. I mean, people say, okay, this isn't bad, this isn't contagious. Yeah, this thing is, and just like a couple of us have stated that, okay, we're hearing some of the story, but we don't know completely everything what's going on. And I don't like wearing a mask, But because I'm concerned about myself and other people, I put on a mask when I'm in a grocery store touching my produce. I put on gloves just because everybody, let's just be honest, everybody's not clean. So this is just one of those examples that, you know, you have to protect yourself and should also protect those people that you might not even know. So it's just one of those things that, I mean, yes, there is that sense of entitlement, but it's just better right now that we just have on our masks. And trust me, there's many times, many moments when I'm in my building, I don't wear my mask. But if I'm going to so many different places, I don't know, if I'm in the mall, or else eventually when we do open up our church, we're going to have masks, because that's just the way to go, because it just makes everyone else feel a lot safer and calmer. Do they work 100%? Not really, but anyway.
O'Shea.
Yeah, no, I honestly, first and foremost, like, I want to give a shout out to Kareem and to Andrew, because the fact, for real, because the fact that you guys disagree and that you're still choosing to wear the mask is being an upstanding citizen. Like, for real. That's what we need in these times. So I'm first of all going to give you guys an applause for that. But now I'm going to come for your heads. I'm just kidding.
I do think that when this is all over, though, I think that when they do an inquiry to see how things went, you know, what could we have done better, I think they're going to say we did overreact a bit. I think that'll be one of the big things.
But let O'Shea go.
For sure.
Yeah, O'Shea, go back in.
I want to see him come for me. No, I'm kidding.
With you guys talking about, first of all, immunity and vitamins and all that stuff, what you have to understand is for us to actually achieve herd immunity, we need 70 to 90% of people to actually get infected. And that's assuming that there's only one strain of this virus. When we've heard multiple sources, what's his name? DeAndre Jordan, one of them, who has contracted it twice. So that shows A, that there's more than one strand, or B, that you can actually get this twice regardless of whatever immunity that you have.
Did DeAndre Jordan die?
Why does someone need to die for you to care?
You're right. But what I'm saying is it the way that we've made it to seem that we're all going to, like, I understand the population, and I'll retract in terms of, I'm going to retract a little bit. I'm going to retract fully, actually. Forget what I said.
Sick backpedal, dude.
But here's the thing. I listened to a podcast a few weeks ago, and they said doctors are saying that we eventually will just have to live with this virus.
Yes.
That's what I mean. Like, I think we are going to live with the virus is what I was trying to get to.
Oh,
like,
right.
I'm not saying that it's not a deadly, but I'm saying I think we're gonna actually. Doctors have been saying that we're gonna just live with this thing. It's just gonna be like the flu. It's gonna be a virus that we're gonna get, and then we're gonna get over it. We're gonna get, and we're gonna get over it. And the same way, what you guys are talking about, like if we're talking about older population, it's the same way with the flu, how we treat it. You know, but more people. You know the number of people that in old populations that die from the flu every year is more than COVID. It's more than COVID. And so what I'm saying is when we're talking about being safe, well, we never were acted that way in being safe in the past. Why now? With the flu, what I'm saying with the flu, we never did. We never said when a high population got the flu that we're going to say, guys, we need to shut down the entire world. Because a large population of a certain group has the flu now, and we may get the older population and put them at risk for death.
I think the issue with this is only 6 months old.
We send so much funding to flu research every single season.
That's because the flu virus changes
every single year. So to say that the flu kills more people than coronavirus, yes, it absolutely does.
And we have the flu virus, and people are it's still the same.
That's not the point. The point is that there's still so much money being funded to help fight the flu every single year. So
and I agree with that, and we didn't shut down the world. That's my only argument with this, why people are more contentious to it, because we're reacting differently than we have in the past for a virus.
Yeah,
but you're judging deaths.
Different.
You're judging deaths.
It's not just deaths. I'm saying people getting it, receiving it.
The infection rate and the rate of transfer for COVID, I think,
let them know.
Don't quote me, is at least 1.5 times more effective than the actual flu.
I heard
Like,
it was
you
3 or 4.
contract it
It's up there.
a lot easier. So that's where it's a little bit more serious
Let them know.
than the flu. And I think the biggest problem that we have, and it's not just a you problem, it's a society problem, is that we only care when someone dies. We only care when a large population of people end up dying. And why do we need to get to that point to be like, man, let me just put a mask on so that the friends and family, the people that I don't know, aren't dying?
So as you can see, and this conversation like that we're having now, that we've had in our chats, that Andrew and I we've had on our one-on-ones, that we've all had different pockets with our own friends and family. This is something that you're probably having with people. Hopefully you're having it over Zoom and you're not having it on Facebook. Again, hopefully you're not having these discussions on Facebook, because what's the point? But I will say this, and then I'm going to pass it to Andrew and then Bart for closing arguments. Bart already called for the last word, Andrew. I can't go back. Right. I can't renege.
That's fine.
I can't renege.
Whatever.
Can't renege. There's no reneging. But it's important for us to know this, to kind of bring it back to our show and to bring it back to the culture. Statistics have shown that the people who have been most affected death-wise by COVID-19 have been people in the black community. People who haven't had the ability because of healthcare, people who haven't had the ability because of doctors and things like that. They have been the ones who have lost. A lot of them have been the ones who lost their lives. And we want to make sure that you know, as viewers, that if you have been sick, or if you, just because we might not have known anybody who has lost their life to COVID, we recognize that if you have lost somebody to COVID, that hopefully you're not hearing in our argument about wearing a mask or not wearing a mask, liking them, not liking them, that we are not being passive or are not thinking at all about the people who you have lost. Hopefully you're not catching that from anything that we're saying. We recognize that any sort of sickness is a bad thing, and we want to make sure that you know that we are not being flippant upon pain that you have experienced in these last 6 or 7 months. That being said, Mr. Jones.
Yeah, like, I know this is a disease that's infectious.
100%.
And we talk about how this disease is highly infectious. Yet, I still say less than 1% of the nation. Less than 1%, even with all the numbers that you hear in America, that is still less than 1%. It's still, you have to get to 3.2 million to get to 1% of America.
And can I just add?
And I'm not downplaying, because, you know, Kareem knows I am one of the guys that washes my hands, cleans my hands all the time, cleans up.
We both do.
I'm very careful.
Nice throw in.
I just want to put that in there. We both do. We both do. We both wash our hands religiously.
I got Purell in my pocket because one of the things that a doctor said from New York, and he was dealing with, I forgot which hospital it is, but one of the biggest hospitals that are taking care of the COVID patients, because he's up at that point when they're in the hospital in internal care and all that other stuff. What he was saying is, what we need to do to keep everybody safe is we need to always be taking care of our hands, because it's the hands that transfer everything. It's the things like that. And he said, if we're always taking care of our hands, always cleaning properly, always washing, always, walking with Purell. As soon as you open the door of your house, coming out, clean your hands. Touch the elevator, then get in, clean your hands. Go to the car. Like, we have to be constant with those things. So always having those things in our mind. And so if we're taking care of ourselves, I think we can do the job. Like I said, I'm going to wear a mask. I'm going to wear a mask because the law of the land requires it of me. Do I like it? No. Does that mean I'm being selfish? No. I just don't like it. I think it's, and to Adam's point, Adam made a point about saying what we do know is that doctors have been wearing masks for years, and we haven't seen the ramifications. Have any of you guys looked at the data for that? I don't think any of us know. So we have no idea what the data is for those things. So before we say, yes, these things have been happening for years, we have no idea what the long-term ramifications are of these things. Yes, they might not have something now, but we don't know down the road, 13, 15, 20 years from now, if they will have something. All I'm saying is,
What? Bro, it's not like doctors have been doing this for the last 20 years.
No, but
thank you,
I'm
Calvin.
saying we have no idea. What doctor? Okay, have you asked a doctor if they have any ramifications?
Yes, I have. Yep. My sister-in-law is a doctor and has been for years. And I have asked her, and she's like, wear the damn mask. Next question.
Okay, that's one person. That's one person.
A doctor. You asked about a doctor.
Okay, so I asked one doctor. You asked one doctor. So there's
How many doctors have you asked again,
out
Andrew?
there.
I just want to.
We're not that sort of show. We are not that sort of show, guys.
It's getting really petty.
No, we are
Getting
not
really
that sort of
petty out
show.
here.
Well, and if people
We're
want to
not.
get pity, that's fine.
No,
We are not.
We're not. But
You know,
we're not.
there's.
But
It
I
is what
just
it
want
is.
you guys to know I thanked you for wearing your masks. And
Yes, you did.
Let's
You did.
keep it on the
Yes,
up and
O'Shea.
up, gentlemen.
All I'm saying is, listen, we're overreacting, and I think Stefan is right. We're gonna find out later on that this has been an overreaction to things.
I gotta say one quick thing to that too. Now you guys are hearing
Really
Andrew
quickly,
saying that
Kareem,
we're
because
I'm gonna be
I
as quick as I can, but I just want to clear up something just in case there's any misunderstanding. This is not to say that Andrew and I are insensitive to the ones that have passed away and people that are getting
Because
affected.
we know people.
We know people are, so we recognize that. What we're
know
more
people
talking about
personally.
is the process in terms of how to stop this disease or to go about our lives in relations to this disease. The people that are communicating how we stopped it, I don't know if that information is the actual information to help stop the virus. I don't know if it's motivated by different things, because we already know from the beginning of this whole thing that if we look at even the amount of people that are populating, this whole thing as a whole may be getting blown out more than it needs to be. That's all.
And we echo that with you guys. We echo that in terms of, like, we understand that you guys are not insensitive to the people. We affirm that.
Bart, you got the last word on the subject, and then this is, listen, for real. This is likely going to be something that we're going to be coming back to this at some point by the end of the summer, I'm sure.
Yo, Cal looks so distraught right now.
Yes.
Cal's face.
All right.
I just have a question, man. I just have a question.
No, because your question is going to lead to a longer discussion. We got to close this thing up. Bart, I'm sorry, O'Shea.
Have a
I'll ask it
disclaimer,
after.
and I have a disclaimer. And then I have 3 points that are going to be quick. I'm not going to talk long. Disclaimer: we are non-medical professionals talking about a medical issue, and I'm going to address that topic as number 3. Number 1, in relation to a lot of the information that was said specifically by Kareem, coronavirus, the reason why you're hearing it on the news every single day and the fact that your world has changed is because it's a very different type of virus than we are used to. The flu has been around, influenza, for a long time, and it morphs and changes. There are a lot of documentaries that you can read or watch, rather, and learn about how influenza is the most infectious disease that we have to date, and that we do not know how to control.
I agree with
I'm
that.
going to clarify.
And we haven't shut down the world for that.
The reason why we have shut down the world, is the rate of infection. Okay? So how easily it can be transmitted is what makes it peculiar. It was undiagnosable because the person was asymptomatic, did not have it, and then they could go and spread it to multiple people very, very easily. I just looked it up. It's 3 to 4 times more contagious than influenza. The reason why your whole world has been shut down is because the flu, according to the CDC and the WHO, in the last 24 months has killed 62,000 people versus 162,000 people in the United States alone. That's number 1. Coronavirus is different. That's why it's not being treated like the.
That's not 3 times, by the way, that number.
We're not being petty.
Infection rates versus death. That's what I'm talking about. So infection rates 3 times more infectious. Death is the number that I gave. Number 2 is the data involves. So because it's something that has not, the pattern of the coronavirus has not been like the regular flu, the common flu or cold or regular influenza, the data has been all over the place. So at first they were saying, no, it is not contagious because the people are not showing symptoms. Then you find out, wait a minute, this can be within people who are not showing symptoms, and that exactly what happened in New York. They shut down too late. So by the time they shut down, people who already had it that did not have symptoms yet were spreading it on a multiple level. So the data has evolved. That's why the earlier stuff said you do not need to wear a mask. The mask is not going to help you in this case. They have since retracted that. And Tim said you can go on the WHO and look at what the new information is. Again, the disclaimer, non-medical professionals trying to assess a very tough topic that is extremely medical and needs medical expertise. The last thing, and this is it, you are either a skeptic or not of information. So either you believe that the information you are receiving is incorrect, false, not hearing the whole story, and they're doubling down or they're backpedaling on all that they're saying, or you say, listen, I'm going to trust that the system that has been put in place to protect me is going to work to a certain extent. I know it's hard to trust governments and systems. So you're either a skeptic or you're not. You have to understand, in Canada alone, we already register our SIN number with the government. The government knows which car you drive. The government knows everything about it. The government knows all your health needs. The government knows which medical doctor you are registered with and what pills that you're taking. So it's not a matter of whether, if the government wanted to control you or wanted to deceive you, if the government wanted to harm you, there are so many other ways that they could do it. Why would they choose for you to stay at home and wear a 60-cent mask? That doesn't make any sense. The last thing I'm going to say is the overall broader picture. If we were to continue the pattern, would it be beneficial or non-beneficial? If the pattern is for us to continue to wear masks to minimize the rate of infections and lower the curve, if we continue to do that, I think those facts stay true. If we choose to go the opposite route, not wear the masks, and try to roll the dice and say, well, since it's less than 1%, since it's only so few, since we don't have enough data, well, why do we need to do the masks anyways? Is your safety and the longevity of that safety still true year over year, month over month, week over week, day over day? It becomes 100% more uncertain. So it's about risk management. And I think that's what we're talking about. Risk management being managed by medical professionals, and we're not medical professionals. So we can have opinions about what we think should happen, but really, how well can we speak to this topic? Come on, compared to people who are actually living this day in and day out. That's all I gotta say.
So you've heard us all kind of sit down and talk this thing out, and there are just like in our chats about sports or different things, there are agreements and disagreements on a variety of things. Here's one thing that you can know: we are going to do our best to follow the law of the land while it is in place over us. And really, I mean, it's just going to a store. This has been the House of Common Show.